wonderful, and it's also quite limiting in terms of not being able to see each other, talk to each other on live. But I'm sure we all are trying to grapple with this new reality, and hopefully with time we would be able to finally meet and discuss, talk among each other, and take this forward. So I'll just today what we are going to do is to have some ideas about how what is health policy and how it can help us understand the current situation of the pandemic, and the extraordinary situation that we are in currently. We would like to talk about that a bit in a while. I want this session to be as much interactive as possible and limit my presentation to a small story about how public health as a discipline emerged out of a humanitarian crisis similar to that we are facing today. And what sorry, I'll just so if I can all of you respond, can you speak? So I have few questions to ask you. Is it possible to talk to each other? So let's see, otherwise you can type your responses. How do you, like all of you are prospective students of public policy, how do you see the current pandemic situation? What are your expectations from the health system right now? What are you looking forward to? How do you think things should change in from the health system in the days to come? So if I repeat my question, how do you see the current pandemic situation unfolding in the coming days? And what are you expecting from the health fraternity, health system, public health, whatever you understand about these terms, or say health policy or government? What do you expect from this, from all this in the coming days, so that you feel the pandemic is able, we can manage the pandemic better, and we are able to come back to our normal life? What do you expect?
Sir, may I answer the question?
Yes, please go ahead.
Sir, I'm Pranav Joshi and I
Hi,
belong
Pranav.
to Rajasthan. And my assessment of this is that, rather my expectation is that first the government should accept, and world over the government should accept, that this is not going to go away as soon as we imagine it to go.
Okay.
And then perhaps work on the mitigating measures. Because not just India, I think world over we are on this optimism that the virus will run out of its course soon, because of the previous precedents that we have seen that the virus did manage to run out earlier. But considering how malified this is in its spread, I do not presume that it is going to go so soon. So my first expectation is acceptance. My second expectation would be, which the government has been fairly able to do, in my understanding, is to put unnecessary exposure in check. So if somebody has to go for a job, then they have to, because you cannot live without earning your food. But unnecessary exposure should be limited as much as possible. That, I think, the government is doing a fair job on that, and we cannot ask for more. And these two were my main points of understanding.
Thanks, Pranav. Thanks. Any other thoughts? Anyone else?
Yes, sir. Can I answer?
Yeah. Can you
Yeah.
please also, like Pranav, can you introduce yourself and
Yeah,
say,
yeah. I am Varada Marathe and I am from Mumbai.
hi,
So
well.
what I think is to uh, rightly as Mr. Pranav also said that the first thing is to accept that this is the reality of world today. The other thing I think the governments world over need to work on is to upgrade the medical infrastructure across the world. I mean,
Okay.
the shortage on hospitals, the hospital beds, ICUs, and all that we have been seeing. Of course, the level at which we have needed ICUs or such medical facilities, probably, God forbid, we won't need in the future. But still, there is a huge need to upgrade the infrastructure to ensure that no one is left behind in case such pandemic, such medical crisis ever occurs again.
Okay. Nice. Good interventions, Varda. I think somebody else had raised hand. Anyone else?
So may I answer?
Please.
Yeah, good morning, sir. I am Purva. I am from Bhopal.
Sorry?
My name is
Purva.
Purva and I am
Yeah.
from Bhopal.
Hi,
Um,
Purva.
so one of my expectation is that there should be more inclusive treatment for everybody. For
Hmm.
example, we are seeing how many people are battling with mental health in the pandemic, and the
Hmm.
rates have gone beyond 20%. So that is one of my expectations. And second expectation, as the my previous partner also said, that more resilient health infrastructure could be seen in the future, especially in the rural areas.
Hmm. Yeah, we'll see how some of these terms mean to us. Thanks, Purva.
Yes, sir.
Anyone else? If I provoke you further and ask, how do you think this pandemic will go? Pranav said, "Sir, it's not going in any time future. In future, how do you? What others feel? Anything that can like stop this pandemic, save many lives? What are your expectations? Are you looking forward to something?
Uh, Good morning, sir. This is
Morning,
Ishan.
Ishan. Hi,
Uh,
Ishan.
I'm pretty optimistic that already there are medical interventions which can cure the coronavirus and everything. Our recovery rates are pretty high, somewhere more than 60% in some states and all. So I don't think, yes, this pandemic, on a long term, on a social behavior perspective and from a public health policy perspective, will change a lot of things, how we go about our days in daily life. But I'm pretty optimistic that we will find a cure. A vaccine will be coming probably by mid of next. A proper vaccine, credible vaccine, would be coming by probably by next mid of next year. And we already have medical pharmaceutical interventions which help cure it. Yes, the problem of there's a problem of infrastructure, health infrastructure in many countries. Uh, Pertaining to ICU beds and ventilators and all. We need to upscale that and all. But I'm pretty optimistic that we will come over this thing and things will be pretty normal by the end of next year. It will be a memory. 2020 would be a memory, a lesson properly learned well.
Thanks, Ishan. Anyone else?
So may I answer?
Yeah, please.
So I like to add on to the previous point. I just like to say that we can expect a major life-altering change in all of our lifestyles. Even though we can be optimistic that the the virus may go away in a few years, if not next year, we can expect that the way we used to live can be changed drastically. I don't think the same pattern of lifestyle can be followed after this.
Mansi, would
Because
you like to give an example of what do you mean by change in life pattern?
the amount of exposure we have outside, sir, like now we have realized that a lot of things can be prevented by taking safe measures, and like the most basic fundamental thing we have learned this year is how we wash our hands and how we take care of our hygiene. So these are the things that we may have not paid attention to, but has come to light that is so important. So those kind of changes and bigger ones as well we can expect, since you asked what we can expect out of this. So yes, sir.
Yeah. Okay, thanks a lot. Anyone has any pressing point which has not been mentioned so far? You want to put across? You're like very eager to say anything more. Anyone? I see one of your icon vibrating a lot. Maybe someone is very eager to say add few things. Okay, otherwise, let us take this discussion forward. See, if I have heard you correctly, some of you rightly pointed out that this is not probably going to go as soon as we thought it would be, like many other diseases. You also mentioned about the need for adequate health care, particularly medical care. Manasi talked about it towards the end that we probably our lifestyle has to change, the way our practices, practices would change. She mentioned about, as an example, hand washing behavior. Ishan said that the world is also looking forward to a vaccine to come soon, if not this year, maybe next year, and that will probably bring the end to this pandemic. And also, you said that we need more medical equipment, infrastructure, and all of that. I think all of these points are very vital, but I'm also if I, many in today's context is also looking for a medical cure to this pandemic, right? And the cure is emerging in some way, but we haven't got so-called medicine for this vaccine. What we are waiting eagerly for is medicine for this COVID-19 virus. But what we are looking forward to is some kind of management, kind of a treatment where we try to take care of people who have manifested symptoms which are very dangerous. So I'm not going into the detail of the medical side as of now, but basically we are also looking forward to some kind of medical solution to this problem, and which is very valid. What I want to, in coming half an hour, I would like to, or maybe less, I would like to take you through one of the first journeys and developments in health, which went beyond the realm of medical care and vaccines. And we'll talk about how public health as a discipline emerged out of another historical crisis of medical crisis or healthcare crisis, which was the uh, entire set of communicable diseases that used to kill millions of people in the early or mid 19th century. So I'll tell you a story about how one of the most killer disease in the 19th century was cholera, which used to kill thousands of people in a very short span of time, and it would spread from one part to the other country very fast. I use this word pandemic, and there is another word called epidemic. I'm not going into the detail of these medical or public health definitions, but the basic point is, and I am sure all of you, because we are all now overflowed with a lot of information would know what is the difference between pandemic and epidemic is. But to briefly talk about, an epidemic is a communicable disease, which communicable diseases are the ones which spread from one person to the other, which spreads in a very short period of time to a large section of the population in a particular geography. That's called a epidemic. And then when the same disease spread from one geography to the other very fast, we call it a pandemic. This COVID-19 turned out to be a pandemic because it has like touched most parts of the world, barring probably few countries here and there. Most part of the world has been affected by it. So this is a pandemic that and so one of the first pandemics that used to travel from Indo-Gangetic plains to London, to other countries of Europe, to countries in Africa, to America, and killed millions of people was the cholera. I'll show you some graphs, and can you see my present PPT? Is it visible to you all?
Yes, sir.
Yes,
Yes, sir.
okay, okay. Thanks. I get confused with these things, and so I need to sometimes ask you. Okay, so this is the background is one of the visuals that had probably shaken our conscience in a major way in the last 6 months. We saw millions of laborers walking down to their safe homes, traveling hundreds of kilometers. And one of the very disturbing signs that we saw after probably partition. But anyway, let us go back to our discussion. So this is a graph which shows life expectancy of people in England and Wales, the erstwhile United Kingdom. Life expectancy is when you are born, how many years on an average one person is expected to live. So this gives an idea of average years a person would survive. Now, I'm not, for the paucity of time, I'm not going back, going towards the left side of the graph. I'll probably focus on the right side. See, uh, this is England and Wales. Let us look at from the early 19th century, 1801. You'll see that it was almost like it was increasing very marginally till this period of time between 1801 to say 1860s, late 1860s. But from the 1870s, we see significant rise in the life expectancy in England and Wales. So people started living longer. Can you pause for a minute and can you tell me what happened during this period? I'll give you a background of why life expectancy was not increasing earlier. You may recall your history lessons, the late 17th century, early 18th century, and the 19th century. We saw industrial revolution in this part of the world, the UK, England, and other countries. So a lot of people came from rural hinterland to live in cities like London, Manchester, Lancashire, and they were living in very congested settings. And as a result, they lived also in very poor living conditions. They didn't have proper place to stay, didn't have proper water supply, didn't have enough wages to have good food. It was a very pathetic situation that people were living in. Now, what changed from the mid 19th century, late 19th century, that we see life expectancy increasing fast? Because prior to that, in a very short period, There would be recurrent epidemics of cholera. There would be continuous deaths due to tuberculosis, all sorts of diseases which can spread from one person to the other, which we call the communicable diseases, will be very prevalent, and thousands of people will die very early in their life. So what changes? Any idea, any clue? I have written some landmarks here, but what do you think could have changed during that time? Any guess? Why did people started living longer during this period of time? Forget about those landmarks. Don't look at them now. We'll revisit them. Just give your commonsensical understanding. What do you think would have made people's life better that they started living longer? Are you all there? Have you all slept? Can you hear me?
Good morning, sir.
Good morning.
Yeah, I think it was the medical achievements that led to the increase in life expectancy.
Okay. Is this Aparna?
Yes, sir.
Okay, I can see your icons, but it would be nice if you at least all of you. Do you all share Aparna's enthusiasm that this could be because of discoveries in medicines and that brought improvements into lives? This is one
Yes,
of the most plausible examples. Chishman has raised, yeah.
Yes, sir. There might be some reason they have just suddenly grown. They have just suddenly grown up. Their awareness in terms of health might be, or there might be some Christian monasteries were there, and they have just some organized some sort of medical campaign, something like that.
Okay, yeah, good. Okay, I'm not responding one by one. Manasi has raised her hand. Yes, Manasi, please go
So
ahead.
maybe the aspect of like the increase in accessibility to medicines can also be considered a factor as to why the
Yes.
so like since people get to take treatments for whatever problems they had or had access to go to such medical centers, it could have drastically increased the life expectancy as well.
Okay. Yeah, medical technologies and discoveries. Anyone else? I'm not able to see everyone. Advit.
Hello. Yes, sir.
Yes. Go ahead.
So I think we made a breakthrough in the health sector. Considering like everybody started considering health as a major factor for contributing towards a better life. People started uh, like considering health a major factor for life expectancy.
Why suddenly after mid 19th century? Medical discovery looks like more plausible explanation. Emil, I see your hand.
Sir, am I audible?
Yes, go ahead.
So, the late 1850s was the latter part of the Industrial Revolution, maybe more output of medicines because of that.
So, discoveries of medicine. Yeah. Nayanika
More
Mishra.
output.
Yeah. Acha, you mean more production of medicine so that those medicines reaches people. That's what you
Yes,
mean.
sir.
Okay. Yeah. Good point. Yeah. Anyone else?
Could I add from the economic and financial perspective?
Yes.
There was colonialism going on, imperialism was going on. Then industrial revolution came up. There was accumulation of wealth in Europe and especially in the UK and all. So due to that accumulation of capital and wealth, probably they have a better quality of life and everything that might have given them a better perspective to discover new medicine and everything.
So Aditya
General,
is saying something very, which sounds apparently very strange. He is saying if people earn more, better quality of life, then their chances of living longer might be more. How do you think that works, Aditya?
no, sir, it's Ishan.
Oh, Ishan,
Ishan.
yeah, go ahead, Ishan.
So my logic simply follows like this. Before imperialism kicked off or colonialism kicked off, there was not so much wealth in the European nations itself. But after colonialism, they were exploiting their colonies and getting wealth. There was accumulation of capital in the Europe, excess
Yeah, that I
capital in the
got.
Europe.
So how
That
that
might
will
have
help?
brought in, that might have not just given them space for innovations in medicine, but also increase the purchasing power or production power of overall society to get medicine and increase.
Yeah, okay.
That's how the logic, my logic flows like that.
Fair point that probably you're saying that if people's ability to purchase more, they have better standard, maybe there would be things which will improve their lives. One of the things could be medicine, but what else? What else could be there? Anyone who has raised his or her hand and want to make a quick observation?
Hello.
Okay. Yeah, go ahead.
Yeah.
Who is this?
So this is Tejal here.
Hi, Tejan. Yeah.
So I think it can be even more very basic. Like we started adapting to change and we started responding to it in a more better way.
Which changes? Sorry, I didn't get one word.
I mean, since the welfare was happening, so
Okay.
humans were starting to adapt with the change in the environment.
Okay.
And I mean, it's more about the body, like how you respond to the environment. You become more adaptable.
Okay.
That's how.
So, see, thanks, Tejal. So basically, you are saying three things. Well, some people said it could be essentially discoveries in the medical science. Some said then once the discoveries happened, those medicines reached people. Some said it could be because people started, imperialism is in full swing, so you get a lot of wealth and that leads to better quality of life for people. And then some said there could be changes in the behavior because people are more aware now, right? So let us, I'm not discounting any of this, and let us try to revisit this very quickly. This will be a bit rushed side, but I'll try to give you a story of that current state of knowledge at that point of time. See, one of the, like I mentioned, one of the disease that was a major killer was cholera. It killed thousands of people in a very short period of time. But what was the current state of knowledge? People thought that there is something in the air. They called it miasma. That there is this bad air that kills people. So you can see that representative picture. It's like some kind of a ghost which is in the air, which kills people. The ghost attacks people and thousands die. And what are the kind of fight that is happening? How human society is trying to fight? It is fighting with cannons and swords and all that, but nothing is succeeding. So that was the current understanding. So we actually, even in the mid 20th century, we didn't know what a bacteria is. Now we know that Vibrio cholerae, that there is a bacteria, it works in a particular way in the body, and that kills people. That was the current state of knowledge. We didn't know all how. So if I go back to this, you will see that it is still 1864. Louis Pasteur is trying to do his experiments to understand that there is a germ. His germ theory, which I will study later when we study public health in a greater detail. But that the idea that there are these germs, there are these microorganisms which kill people was not with us. If we did not know that microorganisms kill people, discovery of virus happened much later, how would we understand and have medicine? So medicines were far from coming. Then it took some time, another 20 years, to have the first vaccine, even though people didn't know what is the exact, how to kill that bacteria. They developed weaker strains of the bacteria, and the idea of vaccine came. The initial trials were happening by end of the 19th century. And then the antibiotic, which can effectively cure bacteria, that comes in as late as 1920s. Fleming's idea. And then it takes another 20 years, 30 years to commercially produce the first antibiotic. So the medicines that could have made changes into our lives and save our lives came much later. And when they came, they made rapid improvements in human lives. If you see the situation from 1950s, you see that the life expectancy is rising very fast. But then some concrete changes had happened even before that. And one of the changes, one of you have rightly pointed out, is that people's life improved because their income improved, and there were labor movements, labor struggles, where labor said that we need more wages, better living condition, give us some share of your wealth. So that is one contributing factor. But another thing happened in this period of time. I'll just skip this. The same argument for tuberculosis. It took a lot more time. By 1882, we see that the Mycobacterium tuberculi, that is germ, is being identified. It took another 60 years to have the first antibiotic, streptomycin, and then the vaccine comes in 1950s, BCG. It takes a lot of time for these technologies to come, but we see that lives have improved. Why did it happen? There is some more thing beyond the realm of medical technology, and public health gives you an understanding of this. So I'll tell you a short, very briefly, a story of how it worked in UK. There was this medical scientist, very reputed medical practitioner in London, John Snow. He was known for, he was the first person to identify that there is something in water that causes cholera outbreak. There was no idea of germ or anything. He rejected that it is that bad air that kills people. He said there is something in the water that kills people. But how did he discover that? Let us look at this. He looked at, this is the map of old London, 1854, when he is doing his experiment, John Snow. He went to every household in that locality and tried to identify where deaths were happening. All black dots that you see in the map are the deaths that have happened in these households due to cholera in a particular period of time. He realized that all the deaths are concentrated in a certain area of London. It is around the Broad Street. So what is there in Broad Street? Snow tried to inquire more. Then he looked at various other factors. And then he said it could be that water is one of the sources for the bacteria. So for the whatever the killer that kills people, the cholera germ, though the term germ was not discovered. So he realized that those, do you see those square black, these are the various black squares are various sources of water in different parts of London. And he realized that this one source in the Broad Street, that all the people who died were taking water from. Many people in that region around Broad Street were taking water from this particular source of water. So then he went to the pump site. So then he went to the source of this water. And what he found out is that uh, I'll come back to this. What he found out is this particular source of water carries water, pumps water from the downstream of the Thames River. Huh? What is the significance of downstream? And the other pump sites are taking water from the upstream of the river. So what is the significance of downstream? So all the contaminations that the city produces, the solid waste, everything was going to the Thames River, and with these solid waste, the whatever that killer, now we know it's as a germ or bacteria, is getting mixed into the water of Thames, and that contaminated water comes to people, and that's how the cholera epidemic is spreading. So he said, with detailed investigation, he concluded that we need to stop exposure to the contaminated water on a large scale and stop exposure to entire supply of water from that area. And when he did that, he could eventually save a lot of life. What he proposed instead are something like this: the tube wells that were installed in various areas of London. If you go to some of these old London, you'll see these tube wells there. And what are they doing? They pump pure water from groundwater rather than surface water from the river Thames. And that simple measure saved millions of lives and helped us overcome this menace of cholera in a major way. In today's time, the cholera virus is weak and it uh, cannot kill the way it used to be killed. And when medicines came, vaccines came, it was much more easier to prevent lives of people who are suffering from cholera. But this simple thing actually protected people from getting infected from cholera, and that's how lives were saved. So that gives an understanding that Snow's experiment gave an understanding of, even without having a thorough knowledge about medical technology and how vaccines, viruses work, bacteria work within our body, we can, with scientific inquiry, identify risk factors, and we can prevent lives. When you said the issue, when you talked about the issue of hand washing, it came through that kind of an approach, that it is through our hand that we that the COVID-19 virus is reaching people's faces, mouth, noses, and we need to wash our hands very frequently. And believe me, that would have saved millions of lives even today. When we do not have effective vaccine yet, we do not have the medical technology to deal with the situation. So I'll stop here. So with this word, that health is not only about medical science and technology, but about a holistic approach of understanding various determinants of life and health, including the environment, the water we drink, the way we walk, the kind of relationships we have with people, the way the social fabric is, and all of this are the social determinants of health, which are as important as the medical technologies. So I would stop here now. These are issues of thorough investigation, and much more detailed investigation and inquiry, but I want to now stop and take questions. I want to understand what you have gathered from our discussion today, and if there are issues and questions that you want to raise. So another 10-12 minutes we have in our disposal for discussion and questions. While you are thinking, let me re-emphasize this point that I'm not saying that medical technologies are not important. I'm not saying vaccines are not important, but I'm trying to expand the way we look at health, and simpler innovations and application of scientific knowledge without a thorough understanding of medical science could, like the history has proven, can be very, very effective in saving lives as much as medical technologies do. Questions, observations, comments, if you want to, if the hypothesis that I have tried to develop, if you want to challenge that, if you think this is relevant, any observation, quick thought, please speak it out.
Uh, Sir, I just wanted to clear that when we talk of we were talking about the cholera epidemic in Europe. Is it the same story that Black Death epidemic, or no? It's not.
No, Black Death happened much earlier. It was in the 14th century, 13th and 14th century, and it was also another major cause of death. But this was during the time of when mercantilism started spreading.
Yeah.
People started moving from one country to the other and brought uh, diseases from one country to the other without knowing how it is being caused. And Black Death was a major incidents where millions of people died in a very short period of time.
So, I also wanted to understand, like, public policy has a very strong relation with the mass behavior, how people react to things and all. Uh, Generally, we see that Western countries have a very, right now, have a very particularly, they're very particular about public hygiene and, clean public places, which we don't find much in India. Like, it has started just recently, Swachh Bharat Abhiyan and all. I wanted to understand, does these pandemic or epidemics have this kind of effect on mass behavior of the public, that after a pandemic is over, people become more particular about their hygiene, like we are seeing in Corona itself, that it does this get into the mind of, in the civilizational mind of the masses, that they follow it unknowingly for the rest of their lives or in generations to come. Does pandemic have that any connection with the changing of mass behavior in long term like that? What do you?
It has, of course, you are very correct. Pandemics, such huge shocks have changed behaviors significantly. Not only about people's behavior, but how state responded to the situation. When Jon Snow's experiment demonstrated very effectively, and there was no medical technology available. There was something called a Public Health Act that came into being in UK, and the government started providing better water quality. They installed water pumps everywhere, and they provided better sanitation, started providing better living condition, housing, and all that. And together, all of this had contributed to better lives of people in a major way. So, and also those interventions shape people's lives and also their behavior in a considerably. So it is a joint action between uh, I would say, state intervention, as well as how people react to the situation. And it has to be also kept in mind that human behavior is not, it is ingrained in the local situation, local customs, local resources that are available, the kind of geography that you are living, the kind of temperature you live in. All of this shapes people behavior, your culture. Uh, like those external shocks, certain behaviors are internalized over a period. But yeah, people's behavior matter a lot, and it changes.
Thank you, sir.
I think the report of this John Snow, it was, I think, first it was not accepted by the government of.
Who is this? Can you please give your
This is
name?
Polo. This is
Oh, hi,
Polo,
Paula.
sir.
Yes.
Yes. So what I was saying, that education and awareness is very, matlab, general education and general awareness of the public masses is very important. As because I read about this John Snow report earlier. So when I read it, uh, there was some other guy, I forgot his name, but he disapproved this theory of John Snow, that it is impossible that it is being contracted through water, through contaminated water. Instead, it was coming through air. So that caused many more casualties than it should have costed. So
Absolutely.
I mean,
Sorry, go ahead. Yeah.
so do you think that education and the awareness of the general masses, not as in proper education, but the common general education, is very important for the proper masses?
See, what the incidents that you are referring to, it goes beyond education of the common people. So, the what was the broad understanding at that point, the scientific understanding, which was that there is this a bad air that kills people, and your government system, your society was geared towards this understanding. Many people who propagated such understanding also proposed policies towards that. Hmm? When you bring in a new scientific evidence, John Snow has actually not only brought out the particular evidence how cholera epidemic works, but he also established a new method of scientific discovery, which went to many, which influenced many other disciplines. But at any such juncture, when something which is contradicting to the current wisdom, it is countered very systematically by those who want to protect the current wisdom, the status quo that wants it to be retained in that manner. And sometimes those stubbornness, and status quo kills many people. Some countries in other epidemics, I'm not bringing those references here, when governments didn't give adequate attention to the knowledge, scientific knowledge, actually proved to be very, very fatal for the people. In our country, there was an attempt to some way communalize the issue of the pandemic. Thankfully, that didn't become very popular, but that could have been very fatal. So sometimes it is important that we keep our minds open to scientific inquiries and discoveries, and the task of governments to actually accept scientific inquiries, new discoveries, and uh, implement some of the findings. Sometimes discoveries are not perfect. If you follow the scientific understanding on COVID, it's moving very fast. Within last 6 months, we saw so many changes. And organizations like WHO, World Health Organization, every day or coming a day, bringing new evidence to us, saying that this is right, that is not right. They're often countering their own understanding that they provided few days back. And the major point here for public policy, students, practitioners, and governments is to be open to new ideas and scientific inquiries rather than remaining limited in their vested current interest. So we should take things into, but as students, we also need to look at the political economy of behavior, the complex relationship between actors of various kinds, which shape human behavior and the response of the government. Yeah, any more?
Good
Tejal,
morning, sir.
is it,
Am I audible?
who is this?
So this is P.Sc speaking.
Yes, go ahead, Tejal.
Yes, sir. So, sir, since you talked about mass behavior a while back, and I wanted to ask a major key issue that we can say that India is facing in controlling the impact of COVID-19 is the trust deficit in the public health system. We could say that includes fear of isolation and the stigma attached to it. How much or to what extent does public health policy play a role in contributing towards increasing this very faith in the or restoring this faith in the public health system?
Very, very profound and very important question. Pranav, I'll take your question later. If you, Tejushi, this is very critical. The way government responded in state responded to this crisis is actually, it is not only people who are not confident about the health system. The government was also not very confident about their own health system. The critical question is, how do you change it? And we have good examples, in fact, in the country. When you, if you take the example of Kerala in a major way, or say to some extent the Dharavi slum experiment, which you can read in greater detail, where you bring people into the center stage of crises in terms of hearing their voices, taking their help in bringing about change, it makes a lot of difference. So how do you win trust of people? You make them part to it, give them information, tell them that this is the situation we are in and this is how we want the situation to change, and please cooperate, please help us. What Kerala is doing, there are volunteers who are helping in contact tracing. Everyone may not be trained in public health or medicine to be able to help in this crisis. People might be able to identify that there are elderly people in the locality who needs additional support when there is a lockdown. That can be a great help. If a friend or a family member is under some kind of mental distress, the family members or friends, the society, they can identify early and take that person to health system. People is the center of a health system. It is for the people. Often what happens is the health or government system responds in a very bureaucratic manner, top-down manner. That we know more and we ask you to do certain things, you follow these things without being very sensitive to the needs of people and the demands of people. A responsive state always helps win trust of people. In a very nutshell, I would say that. Yeah.
Thank you, sir.
That satisfies your query?
Yes,
Yeah.
sir. Completely.
Thanks. Anyone else?
Yes, sir. Hello.
Yeah.
Yeah, I'm Satya, sir.
Hi, Satya.
Hello. Yeah. So, like, what are the economic problems which can be addressed, during this kind of pandemic or epidemic situation? Because, it totally stopped the economy and people like migrant workers are
Satya,
totally.
I'm sorry, your voice is very low. I couldn't get the question well. Can you be very brief? Because I think we are running short of time. I'm not sure the organizers can extend this further, but let's take your question very quickly.
Yeah, how can the economic problems can be addressed during this
Economic
pandemic?
problem.
Problem.
Yeah.
Yeah.
Okay. Good point. That's also it. That's a very critical this thing. I would sorry others spare this for few minutes because I joined also a bit late. So I'll just address Satya's question and close probably. So there could have been several things done. One of the things could have been to give better food, wage support, and nutrition support to the people who, particularly the migrant workers. The schemes like National Employment Guarantee Scheme or transfer of direct benefit transfer to people could have helped many people overcome hunger. There was widespread hunger and destitution during that time. The other thing would have been investment on public health. You build your health system better, recruit more people. There are huge vacancies. These are economic challenges. You might also at this point of time need to stop all the investments that you had earlier committed which are not very productive. For instance, using public money to build structures which are not necessary at this point of time. We might also think of stopping investments in, say, purchasing very high-end defense equipments. Rather, invest on education, health, and social security so that people can be saved out of this. The young children, the children from a deprived section are facing a major crisis which is really not being addressed adequately. How would they, for us who are better off, our schools, colleges are going on, but those who cannot afford smartphone, the schools who cannot have digital technology, how do you enable them? These are the economic questions I would have liked to be addressed. If there are no more quick questions, and my apologies, we couldn't discuss certain things in detail, but I really loved talking to you, and I liked your question, and I'm very sure that we are going to have very enriching time with all of you in the coming 2 years. All the best, and hope your experience in JSGP is really enriching like it had been for many of your predecessors. Thank you so much. Thanks organizers for doing this. Hope to see you soon. Take
Thank you,
care.
sir.